Have you been advised surgery for your back pain? Was surgery the only option given? Can you get better without surgery? Well, let's find out. Hello everyone, welcome to the Spine Chapter, where we're going to talk about your spine health with some simplicity and a little bit of insight. I'm Dr. Vishnu Nair. I'm an orthopedic spine surgeon and an endoscopic spine and a minimally invasive spine surgery specialist, and I'm going to help you to the twists and turns in your back pain. Getting rid of back pain. Well, do you know that the likelihood of you living your whole life and not having back pain is almost impossible, which means throughout your lifetime, at least once, each and every one of us go through back pain. So the question comes, why us? Well, we humans seem to struggle a lot more than the other species, right? Well, picture this. We evolved from quadrupedal organisms to bipedal. While we were quadrupedal, we used 4 of our limbs all on the ground, and none of the weight distribution was coming on top of our spine directly because the gravity was being eliminated. Although, as we evolved and we started to stand erect and we walked on 2 feet, that is when the spine started taking all of the weight. So the most important structure to make us stand erect and help us in locomotion, that's movement, becomes our spine, because it helps transmit weight from the upper body to the lower body while movement. So it quite literally carries the whole weight of this world on its bony shoulders. Now let's take a quick peek at the anatomy of this complex structure. It's just so beautifully made. So from our neck all the way down till our hip joints, there are bones stacked one on top of each other. And if you can see, there are these cushiony things in between each of these bones to help form a shock absorption, which also helps in movement. So these vertebral bodies is what we call them. These are like building blocks to a huge high-rise tower that we see around us. So its built and design is so well that it can take all of the weight, not crumble, and also protect a huge thing within it. And yes, that is the spinal cord. So if we want to move our legs, or if we have something hot or cold on our legs, how do we feel it? Well, our brain has to first process it. For that, we need the brain's extension all the way up till the legs and our arms. Now that's where the spine comes into play. Now this bony structure within it carries that extension from the brain, called the spinal cord, and travels all the way down till the hip joint. Now there's so much more in the anatomy, and it's a very complex topic, so that will be for another video. So why does this complex structure cause pain? First, let's try to understand what is pain. So this study, published in the Pain Journal in 2020, September, defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Too complicated? I'll tell you in simple terms. Pain is basically just like an alarm telling us, hey, something's going on wrong in the body, and I want you to pay attention to it. It could be any kind of small damage or something that is going into damage. So why do these pain alarms come out? What could be the cause? It could be because of 5 reasons. First, traumatic. Second, degenerative. Third, inflammatory. Fourth, infective. And last but not the least, could be because of some growth or a tumor. Now I want you to understand the order in which I mentioned these. Because the first 3 ones are the most commonly seen, and the last 2, although very less likely, could be the part of the diagnosis. Now, why are we as spine surgeons important? Now, we want to identify and diagnose exactly out of these 5 causes what exactly is your problem. Now, we have various ways of diagnosing using some blood tests, maybe some physical examination, and even multiple combinations of all these and history taking would easily let us know and categorize into which 5 of these problems that you have. This helps us streamline your treatment into what exactly needs to be done, because once we know the cause out of these 5, it's very easy to treat. So the 5 causes. First, traumatic? It's simple. You slipped, you fell, you landed awkwardly, you had a fall on your back. It's a mild trauma. It could be any small incident that could be traumatic. Second, degenerative. As you age from your 30s to your 40s, problem is your spine starts degenerating. The discs starts losing its watery, gooey nature and movement becomes stiff. Now I know you've all heard about disc prolapse and sciatica. Now it could be a traumatic sciatica or it could be a degenerative sciatica. So with passing age, if you don't exercise and if you're not at your best form, the disc could prolapse. Similarly, if you had a fall and you slipped, the trauma could cause the disc to prolapse. Now third, inflammatory. Now inflammatory is a category in medicine which is so vast. It's very hard to pick and diagnose exactly what type of inflammatory condition you have. There is no cause many a times for this inflammation, although can be treated with medications. Fourth, infective. We know about infection, right? We get a cough, we get a cold, could be a bacteria, could be a viral infection. Similarly, infection could be in and around the spine. It could be in the bones, could be in the disc. It could be even in the canal where the spinal cord is passing. Last but not the least, very severe pain in the back could also be because of some growth. Could be a tumor, could be cancer. So the most important thing is to diagnose. The first step we need to know is out of these 5, where exactly does your problem lie? Once we know that, then streamlining your treatment is very simple. 90% of the people that I see in my practice have back pain because of the first 2 problems, degenerative and traumatic. And another 5% comes in the inflammatory. So infections and tumors are very less common, although not to be ignored. Hey folks, if you're enjoying what you're watching, please do hit the like and subscribe button below. It will be great for me to increase my community and grow from here. Thank you. Now here's the scoop. I'm a spine surgeon, right? So does back pain mean I'm always going to take you to surgery? Absolute no. In fact, I'm a firm believer that back pain does not need surgery. Almost 90 to 95% of those cases can be treated very well with physical therapy. So I believe that physical therapy is almost a gold standard when it comes to most of spine problems that cause spinal pain. Of course, we might need to add in some analgesics, some medications, some rest in some cases, and not to give a lot of rest in some cases, depending on what the problem or the diagnosis is. Now again, the 3 last causes I spoke about, inflammatory, infective, and tumors, these are a little more complex. We need more evaluation techniques, we might need more blood tests to exactly know what are the problems, and we might need a whole lot of medications to treat and get you back to how you were before. So understand this, we're not here to push you into surgery. In fact, we don't want to keep on operating for unindicated reasons. The most important thing we want to do is find out the cause and explain to you scientifically what exactly should and should not be done in different diagnoses. But remember guys, spine should be taken care of and the problems that come with it should be tackled early. If not, you could land in many problems which you probably never want in your life. So treat your spine with love and respect and it'll thank you for the years to come. So that's it for this video guys. I'm sure you guys have a lot of doubts and a lot of more topics that you want to discuss. Please leave that in the comments below and I'm going to surely get back to you. So until next time, it's Dr. Vishnu signing off from The Spine Chapter.